All right. Ben, welcome to Health and Hormones.
We're finally on.
We made it.
They get to put a face with the voice that
That's
was
right.
behind the camera. Against my will.
We're glad to have you on camera.
Thank you.
Yeah.
Excited to be here to talk about progesterone. Look at us, synced up. You know what? This is actually, I'm pumped for this one because I don't know much about it. Not like I know a ton about the others, but it'll be fun to hear all your knowledge on this, on progesterone.
We are excited to have you on. We're excited to talk about, I love progesterone.
Yeah.
It might be one of the only hormones that would be a blessing if it was leaked into the water supply for women, and because the more they have, the happier they are.
Really?
And the better they feel, yeah.
What is it? So I know it's another hormone, but help me understand what it is and maybe its function.
Okay. Progesterone is a hormone in women. It's one of the few hormones that is not in men and women.
Okay.
And it is a partner with estrogen. Progesterone and estrogen work together in a younger woman to form what's called a menstrual cycle. So in young women that haven't had a menstrual cycle, that's one of the hormones they don't make. And as they start menarche, which is your first cycle, women have a process where estrogen will go up and progesterone will come down. And then after half the month, they'll switch. And so it is directly related to the estrogen levels. Now there's a whole big process that happens inside the body, but its main function is to help women have a ovulation, and then if they don't get pregnant, to have a cycle and to help bleed. And so it's crucial for their well-being every month.
And crucial for procreation.
Absolutely. We're seeing one of the biggest problems with young women having a hard time getting pregnant. It's all related to their progesterone levels.
Interesting. Do you feel like the knowledge out there, the kind of the studies out there on progesterone are sufficient, or why? I guess I don't feel like it's a common talked about hormone.
Yeah.
I feel like estrogen and testosterone get a lot of the attention, if you will, or the comments on it. Why is that? Is it just understudied? Is it under?
That's a great question. I don't know if I can answer the why we don't talk about it enough. But I just was called from a patient in Missouri, and we talked, and none of her doctors would even talk about progesterone. She had a friend that came in here, started on the hormone program with us, and her friend said, "My life is changing. Go get some." And she just wanted to go to her normal doctor, and he wouldn't even entertain the thought, wouldn't even do the blood work. And he said, "You don't even need it." And unfortunately, too many people aren't even given this option to check it, to look at it, or to even feel better. And so it is one of the most powerful hormones I've ever found to helping a woman feel her best. It is absolutely a game changer. So why is it not used? I don't know.
Yeah.
I can't. I
Yeah,
don't
that's
know.
a bummer.
It's so sad.
Yeah. In a female with low progesterone, how will that show in their life?
That's a great question. So progesterone helps regulate the cycle. So a young woman who has low progesterone could have a couple of changes. She could either not have a period at all, or if it's really low, then she'll go from having very heavy flow, more than 2 days. I've talked about this a lot on our TikTok, so if you haven't seen it, check it out. But you should never have a flow that's heavy, painful, cramps, any of those symptoms that you would call PMS are all related to progesterone. Also, the amount of blood loss, how heavy the flow is totally related to progesterone. Now, leaving the menstrual cycle to the side, if a girl is feeling depressed, if she's having postpartum depression, if she's feeling suicidal, every single time before you take a new psychiatric diagnosis, you have to know your progesterone levels, because the lower they are, the more depressed they feel, And it's so heartbreaking to see girls suffer for years. And by the time they come or heard about me or saw one of our videos and they come in and to find that their progesterone is 0.0, like they have nothing. And so of course not. They just don't feel very good. In fact, they're miserable. They feel terrible inside.
How will that show? You say they'll feel miserable, and you've given some examples of heavy periods
Sure.
and some of the heightened PMS symptoms. How else will that show in a woman? I understand a lot of it can also help with sleep when your progesterone's regulated.
Absolutely. So a normal progesterone helps very much with sleep, especially as a woman gets older. As a woman goes into menopause, women talk all the time, I can't sleep anymore, my husband snores too loud, or whatever the symptom. It has nothing to do with that. It has everything to do with your progesterone levels. The other thing that is affected and very important for women is that progesterone protects you from acne. So if you're a young girl having terrible acne, you need to know your progesterone, because progesterone protects you from especially the cystic and when you have it everywhere on your face. And so progesterone is super important for your skin, your mental health, your sleep, your mood, and of course your cycle. But I would tell you what they don't want you to know about, or one of the things that I think is the most important, is progesterone is the number one way to protect a woman from getting breast cancer.
Interesting.
Yeah.
And they don't want us knowing about that.
Well, there's a lot of money in treating cancer, so we don't want that word to get out, right? And so, but it's the higher your progesterone. And I've had patients come in who've had hormone positive breast cancers, and they've always told me that their cycle was terrible. It started when they're 13, 14, or 15, and they were heavy. They're 7 to 10 days or 14 days, and their whole life was like that. And so they literally, their whole life went through not knowing the benefit of having a high progesterone and the joy that they could feel of feeling amazing inside, because that hormone is working for them.
Are there any ways, so just thinking, if someone says, okay, I'm going to try this on my own.
Sure.
What are the ways someone can increase or regulate their progesterone?
That's a great question. The reason we don't make a lot of hormones, or our glands and organs that make hormones don't work as well, is because of our diet or our exercise. And so I tell patients, if you want to naturally get healthier, become a very healthy eater, which means it's not a diet, because I'm not a big fan of diets, but cut out the crap, cut out processed foods, cut out the sugars, and then count your carbs. We'll have a carb for breakfast, a carb in between, a carb for lunch. Pretty soon we've eaten so many carbs that the amount of exercise to burn that off so it doesn't poison our system is so high that nobody can do that. And so cut back on your carbs and then get your exercise up. And one of the most important exercises that I think that will give you the best results of helping your system is something called HIIT training. It's real popular, but it's called high intensity interval training. And the reason is that is so effective of really pushing your muscles to the point that they have to take up all the sugars out of your system. And the way it does it a famous workout, the P90X, talks about a thing called muscle confusion. And it really does. You are working out so hard your body doesn't know, do I burn or not? And you want that muscle to work out and to be confused and want to really gobble up as much sugar as you can out of your bloodstream.
So by increasing your lifestyle habits, or improving, I should say, and just making a few better choices in what you eat and maybe your exercise and activity, you can help some of your levels.
Absolutely. And the blessing of that is it's not just progesterone, but it's every other hormone that you make. And so absolutely, lifestyle is so important. Now, one of the problems that patients will come in and say, hey, I'm a marathon runner. I'd go way overboard. And there are cases where if you exercise too much, that will just shut off production of hormones also. And so, again, there's an important with being moderate, right, and not taking our workouts and cutting back on food so much that we go to the opposite, where we starve our system of the nutrients it needs to function normally also. So there's a balance in there.
Talk to us, Dr. Allen, if you would, about miscarriages. And I know this is a super sensitive subject.
Yeah.
Many of us have been affected by these in our life. And so we definitely want to be sensitive, and our hearts go out to the people who are dealing with this right now, and who have dealt with it. But talk to us a little about progesterone and specific to pregnancy and miscarriages, if you would.
Well, Ben, and this is always very personal, but I don't know of any doctor who's more passionate about this than I am, because we lost 3 pregnancies and we lost 2 sets of twins naturally. And so nobody wanted their family more than I do. And so I love this topic. And not that I love what I've suffered or what my wife has suffered. Now, she suffered, but it's also so heartbreaking for me because we wanted this together. So first of all, progesterone is one of the most important hormones to carry a baby to full pregnancy. And it is heartbreaking when I'm seeing girls who've had multiple miscarriages, they've had their workup, and then they come see me and we check them and they have less than 1 progesterone. Like, how do you carry a baby to pregnancy? And their doctor will say, well, we did the blood work in the wrong time of your cycle. Well, that could be true, but when in your life do you ever have to have 0 or low progesterone? You should have some progesterone at all times, and there's times where it should be higher and lower. And yes, of course, that's true. But how have we accepted to the point that now 0 is normal during certain parts of your cycle? Because it should never be low. The hard part about a miscarriage or something of this nature, there is always the risk of a genetic abnormality. There are some people that are healthy, they're fit, their hormones are right, and they still have a miscarriage, and that happens. And if you were to do the genetic testing of that loss, you would find out that there was something abnormal, and the baby wouldn't have been able to survive a full pregnancy. So we can't say that this fixes everything, because it doesn't, right? There are changes in us. We're learning so much in medicine all the time about foods and different things that we put into our body that can harm the eggs, right? But throwing or putting that to the side, if you're not healthy, then even though you have a normal egg and the sperm come together and you have a habitable uterus to carry a baby to full term, if you don't have the hormones to help it work and function, you can't. And so one of the special messages I got today that I wanted to share about this is we had a girl who's had multiple miscarriages, and we got her in our program. We got her regulated to give her some progesterone, and then the first month we started adjusting her progesterone to help induce ovulation. We found out in 1 month she's pregnant and super excited, and it works. And so it's all about getting.
So it can even help
hormones.
with conception. Absolutely,
because you have to be able to ovulate, and if you don't know when you're ovulating, how do you know when to have intercourse to help with that process, right? There's tests, but they're not always 100% reliable, and so it's about getting everything in the cycle correct so that you can have a normal pregnancy.
Yeah, and I knew that, of course. I was just making sure.
Yeah.
Yeah.
Of course you did.
Well, that's amazing. I hope that's some powerful information for people out there with, like we said, like with that tough situation that they're living. And
It's heartbreaking.
yeah. And
In
so
fact,
thank you for...
I remember we had lost a set of twins, and the very next day a patient came in with brand new twins, and I remember I had to walk out of the room and I wept, because we know that people suffer. We know that, and so we don't want to minimize that or anything, but what we want to do is give you hope, so that if you get right, that maybe the next time you don't have the same outcome. And that's our hope, is that we can't go back and regain what was lost, but maybe we can help you so that you don't have to repeat that, because that's where it gets really painful.
Okay, so now we've talked a little bit about progesterone in affecting the conception and even the in cycles, and then in birthing and pregnancy and conception, all that. What about postpartum, after giving birth?
Well, I will tell you that postpartum depression is something that's happening all over, and is a disease that should never even exist. It's that easy to treat. You can cure it almost within a few days, because what happens is you get pregnant, and the amazing thing that your body forms inside the uterus is a sac that holds the baby, right? It provides nutrition. It provides nutrients. It is the most amazing. The fluid around the baby is so, people are using it. They're now putting into gels, and they're eating. It's so amazing what happens to bring a child to life. It's magical, and almost, as a doctor who studied it and learned about it, and really we barely know a fraction of what the process is, because so many amazing things happen for a woman to create a life. But then what happens? Well, you deliver the baby, or usually the sac ruptures, right? And then you deliver a baby, and then what happens? This placenta is delivered shortly after a baby. Well, nobody even thinks about it. It's set to the side. I remember I'm having delivered 100 babies, you just throw it to the side. It just sits there, and nobody did anything back then with it at all. Now we know the value of this organ that is a new organ developed inside your body, which is amazing. But in that process of pregnancy, the placenta takes over producing progesterone. So that normally the ovaries would produce the progesterone, but they can kind of go and take a break, which is why pregnancy is so important for a woman's cycle. Having children is a wonderful thing. And so this placenta forms, carries the baby, but then you deliver it. Well, what are the ovaries supposed to do? Wake up like tomorrow I can wake up and start
ready to rock, yeah.
And that doesn't work like that. And we are seeing women who have levels that carry their baby into full term are really high, sometimes 10, 20, 30 times normal levels, which is that euphoric, happy, wonderful state that a woman can feel during pregnancy, to going to zero. And so all we got to do is replace it. And so once we get message of girls postpartum, we can add progesterone. There's natural forms of progesterone. And within days, they're like, oh, I don't feel like I'm dying. I don't feel like I don't want this baby, or all the terrible feelings that they're going through. It's not them. It's that the key, because a hormone is just a key that turns on function, it's gone. There is none. And so how do you have your body function when you don't have that hormone? Again, just replace it.
So the treatment for that is shortly after delivery?
If they need it.
Yeah.
Because not everybody
checking
experiences
levels,
it. To get a blood test and check. But if somebody comes in and says, I just had my baby and I'm feeling suicidal, I'm feeling scared, I'm scared to have my baby, like all those fears that women really suffer with and are legitimate fears, right? Because you have a new life that you're taking care of. But then they can go to an extreme where they're like wanting to leave or walk away. Well, a lot of times that's not them, that's the lack of this amazing hormone called progesterone.
Amazing.
It is amazing.
That's
And
important.
I'll tell you what's amazing. My favorite thing about progesterone has to be that when my wife's levels are high enough, she feels so good, so happy that something breaks inside of her mind because she thinks I'm sexy and good looking. She loves me, and I don't know how it works, but joking aside, she just feels amazing and sees the good in me. And so I love progesterone for what it can do to help a girl feel their best.
Amazing. You already have gone over one patient-specific story. Do you have any other that come to mind of where progesterone was lacking and it helped one of our female patients?
Sure. Well, I'll give a couple examples. We had a young woman who was having around 14-day, she was menstruating for 14 days. She'd have her normal cycle and then 2 full weeks of bleeding. Heavy bleeding, blood clots. We did a blood test to see where they were at and found that her estrogen to progesterone ratio was completely out of balance. And, we like a healthy ratio, and hers was hundreds times that of abnormal. And just within replacing these hormones and then giving some supplements and vitamins to lower the estrogen, we were able to get it where it went from literally 14 plus day of menstruating down to 10 on the next cycle, down to 7, and then so literally 4 months into it, she was at a 4-day. And she's like, I can't believe this. Like, literally gave her back 10 days of her month that she didn't have to suffer or be in pain or bleed through or have to leave, because she was in school, had to leave school because of how heavy a flow she had.
It's amazing. And you bring up estrogen, which next week we'll talk and go in depth on estrogen. Tell me a little more while you bring that up with that specific patient, the relationship between the two. You talked about in their cycles that they kind of crisscross throughout the cycle.
Yes, they do.
And you want that happening?
We do. Because you want to have a normal cycle. And so, I need to be careful, on the camera of giving values, because we just had a patient who is out of the state that we're in, and they were comparing their labs to our labs, and they use a different measurement.
Right.
And so I'm trying to be careful not to use exact numbers, but the ratio is a balanced ratio. Generally, we focus on the hormones that regulate on the ovaries called FSH and LH. And ideally, we like to have your FSH 3 times higher than your LH. And when that happens, everything else below is working perfect.
And that's when progesterone and estrogen fall into place as well.
Perfect.
When those
and those are the hormones that come from the pituitary gland down the ovaries. And when you're at a 3-to-1, then we know that you're going to be in a healthy place. That's the most important.
The human body is just
amazing,
unbelievable.
Yeah.
To have all that organized.
And not only do they have it to control the pathway, but they have the reporting mechanism that goes back and reports to our brain and say, hey, we're good or we're not. So, and it's this unbelievable negative feedback loop that is absolutely incredible.
That's awesome. You have another case that maybe is different than...
I just had an elderly woman in her 70s who came in and was done with her husband. I can't stand him anymore. I can't even sleep in the same bedroom. Everything he does annoys me. Their marriage was struggling. They had come into our office for some skin treatments, and we talked to her about that. She's like, hey, let me see where I'm at. And literally, because of her age, and she was in full menopause, which means you don't make hormones anymore, her level was 0. Everything was nothing. And so we asked if we could just optimize her hormones. And we told her that we use natural bioidentical hormones. And so she was interested in using a natural hormone. So we slowly, and because of her age, we had to slowly start titrating herself up. But the miracle is I just saw her and I asked her, how are you doing? And her response was, what does that mean? And she's like, I've never loved my husband more. We sleep in the same room. He doesn't annoy me. They've been traveling. Their whole relationship is better. She goes, I feel so good inside that I enjoy being around him again. And it was just almost tears, because she said, you never told me that when I fixed my hormones that my marriage is going to get better. And so what's magical is when you feel great, everybody around you feels great. And the saying is true, when mama feels good, everybody feels good. But it's when mama feels good, then dad automatically feels better. Right? And so it was really cute to see them acting like newlyweds. And now I will say that when she started feeling better, he came in also because he wasn't.
Needed some help.
And so they both needed help.
Great.
Right? But it was fun to see how she gone in a complete reversal because she feels her best now.
That's amazing.
Yeah.
No, it's important to note there's no one size fit all.
Absolutely.
With hormones,
Yeah.
and Dr. Allen makes sure we don't give specifics, and he's not telling you numbers of each patient because everyone's different. But the important thing is there's hope and there's help. Right. And here, come see us at Terafe in Mesa, Arizona. We do telehealth, and we'd love to help you out. But thanks for listening again to Health and Hormones with Dr. Allen, and we'll be.
And if you want to feel better, just know that there is hope.